over to you, Mark.
Fantastic. Hello, everybody. Thank you very much, Lee, for all the work setting up this. So, yes, today's presentation takes a slightly different perspective on my recent PhD and focuses on intersectionality within LGBT research. It's kind of a critique of my own research, my own learning throughout the PhD, and it's going to focus really on the scoping review, which in a way has kind of contains contains a lot of this within it. The process of doing the scoping review contains a lot of what I want to kind of bring to the table today. So the aim today is looking at benefits and challenges of intersectionality within a research context, within a queer research context. I'm going to use queer. My history, I worked, volunteered and was involved with ACT UP in the States during AIDS years, and quite active in that field. So we use dykes, fairies, queers, all of those kind of terminology. So if I slip into my native language, apologies. I will try to stick with LGBTQ, but I will sometimes use queer as well. So so it was, again, look at that snappy title for the PhD. It's not what we would class as the front of our priority. And it was a qualitative intersectional perspective on health and social care pathways of multiply marginalised or stigmatised or excluded LGBT people in the Northeast. So this is people who are queer plus experience of homelessness, drug and alcohol use, criminal justice system, domestic violence, racism, sexual abuse, etc. So layered on top of being LGBTQ, additional kind of discrimination and stigma, funded by the National Institute of Health Research. Sorry, I'm gonna stop on my coffee. National Institute of Health Research with the Northeast North Cumbria ARC, and they were incredibly supportive, and done with Newcastle University with my wondrous supervisors, Amy O'Donnell and Steph Scott. It was a fantastic opportunity really to engage with the community. As a gay man, I kind of had separated. I'm now sort of old and married and have a dog and things, and I'm sort of separated a lot from a community that I was very much a part of. So it was lovely to really connect with various and varied LGBTQ people, communities, groups, etc. around the region. Because of my intersectional perspective, I kept wanting to dig further into the margins and reach people who were not traditionally included in LGBT research, which resulted in 72 interviews. So 33 with professionals working across multiple fields, and 39 with marginalized LGBT people, and just under 67 hours of interview data, which for a novice researcher was quite a challenge, but very rewarding. So there's lots of output. Scoping reviews just about to be released. There's a book chapter that's gone through. There's 2 other papers in the pipeline, and I'm also doing a bit of extra further work from the research. And it was important to me to release plain language reports for those for the other sort of 99.5% of the population who find academic writing a little bit dense. So there's a project website there with the link, Joins Up Northeast, and there's reports in various formats and adapted ones as well. So it's quite important for me for it to be fed back to the community. And it ended with an event. It was a really lovely event with multiple kind of, LGBT people, professional stakeholders, wider kind of people involved as well, looking at intersectional approaches and reaching marginalized groups. And those kind of funny things are all post-its from a couple of the whiteboard exercises we did. And it was surprisingly, I was very surprised by the engagement and the feedback from the community. It was great to check my findings as well and find out how relevant they were to people. So I went in thinking that with a sort of anti-methodological, theoretical standpoint, but actually one of the joys of the PhD is this kind of digging into things and yourself and digging deeper. And I realized that I carried with me a lot of kind of my theoretical background was around intersectionality, feminist and queer theories. And they all, although they're different, obviously, and they have differentiation, and you could challenge, each one could challenge the other. They also kind of feed off and have improved each other with their own kind of complementary bits, which were, I think, for me, it's looking at this, the Venn diagram, the intersection of those three. They all question existing structures from the perspective of those on the margins. And that was really the kind of approach I adopted and went into this study. So what is intersectionality? I may be preaching to the converted here, so I'm not going to go into too much detail. And I could go on about this for years, but I think this definition from Joshua Collins here, it offers critical insight into how social determinants operate, not as isolated, independent entities, but as reciprocally constructing phenomena that shape social inequalities. So, for example, a gay Asian male in a Asian community setting will have to dial up the Asian and dial down the gay, and then in a gay organization or within a gay kind of event will dial down the Asian and dial up the gay because of some of the racism may be inherent in the LGBT kind of spaces. So it's this idea of these kind of fluctuating social positions, and people's identity lies at the intersection of these positions, and those help to construct people's and shape people's experiences. And I strongly believe now, having done this, that without considering this in our research, we really compromise the results and the findings in terms of their relevance to wider populations. So within population health research, and I don't know what backgrounds people are from here, but within population health research, there's been a tendency to kind of put to try to quantify intersectional studies and focus on race plus gender, race plus sexual orientation, as if you can put those in an Excel table and make a matrix. The problem here is that we focus on identity. So in popular discourse, intersectionality is considered to be around these identities. So, the black lesbian, the gay man with, I don't know. So the focus on these identity categories actually kind of does intersectionality a great disservice, because it's at its heart, it's the questioning of social inequality. So rather than looking at race and gender, it's looking at racism and sexism, misogyny, and the impact that those have. So focusing now on the scoping reviews, that's a little bit about the theoretical background, and let's have a look at this in practice. So here was my scoping review, and just come out. BMC have just done the final round of little kind of typos and referencing stuff. So that should be coming out in the next couple of days, hopefully. And it looked at how LGBT adults experience of multiple disadvantage impact on their health and social care pathways in the UK and Ireland. It was a systematic, it's a scoping review that followed PRISMA guidelines. So it was very systematic, actually, a lot more than I'd expected. So within intersectionality, it's an extremely complex, kind of messy business, which is why I think it's pushed to the sidelines sometimes. But here's kind of what I learned. So I started at the beginning when doing the literature search. The traditional, in the UK, the most dominant categories that define multiple disadvantage are experience of homelessness, drug and alcohol use requiring treatment, and the criminal justice system. And they've become our mainstream framework. And as soon as you start looking into the LGBT literature, you realize that those are not particularly relevant. And in fact, other factors may impact more. So for example, a trans person might not go to the homeless, the commissioned homeless service, because where they go in that service, they experience lots of transphobia. So they don't attend that service, and they may stay on friends' floors or sofas or move around and squat in buildings. So these categories have rendered LGBT people invisible. So I thought, right, let's try to broaden those categories and find out what LGBT disadvantage is all about. So I went from those 3 categories, which we'll call SMD3. I expanded it to SMD5, and actually there was more there. So I went SMD plus 8 categories, and I ended up at SMD with 11 categories. And I admit I disappeared down a bit of a rabbit hole, and my supervisors kind of yanked me back out. So you can get lost in this complexity and this fetishization of complexity that can come if you're kind of not careful. So instead of trying to do this SMD 11, there were 41 odd thousand papers. I just went back and went with some sort of irony. Let's go back to those 3 SMD definitions and use them for the review. And actually, I'm very glad I did that. The aim of the study was to explore how queer adults' experiences of these SMD3 categories impact upon their access to and use of health and social care services, because it's the service access and use that is the key factor here, because that's what we measure. So all the stats come from the services. So what are the factors that impact that? So so there was 2 levels to the scoping review. So the first one was a kind of review of the data, and it was really interesting. There was some themes that you might expect, and there was also some themes that were really surprising. So in the field of multiple disadvantage, we have, let's say, this kind of cis white man who's street homeless. He's been excluded from mainstream services, so he can access the homeless service. So he's shunted away from mainstream services into a service. But for LGBT people, they were shunted out of mainstream services, and when they reached the external services that are meant to deal with homelessness, etc., they were either bounced back from there or experienced discrimination, or this wonderful sense, and thank you to Edith England, there was wonderful sense of them being shunted aside. So the trans person comes into a homeless setting, experiences discrimination, causes ruffles with the residents, and instead of dealing with the discrimination, the trans person is kind of shuffled out of the way. And this was seen all over those 3 categories, which I wasn't aware of really. So there was some, as anticipated, there was huge amounts of discrimination and stigma that acted as barriers to service access and use. I could have paused at that point. I think it would have been still very interesting, but this intersectional kind of lens is always there with me. So I thought, hang on a minute, let me go and rechart the literature. It took a huge amount of time. Have a look at the papers and see who is considering, acknowledging, recording intersectionality within their papers. So this might be, was there an exploration of the impact of racial, social class, education, location, geographical location, lots of other factors? Were there consideration of other factors other than sexual orientation and gender identity? So this got a little bit more reflexive and a little bit more caused a little bit me to look a lot in my own rearview mirrors. So looking at the body of LGBT research within the scoping review, there was a mirroring of societal privilege within this. So men made up a huge cis gay men made up a huge kind of proportion of the research. Very few papers provided any data on ethnicity. And of those, there were 150 participants, 90% were white and none were Asian or of Asian British ethnicity. And what I did in this and my PhD and in all my future research, when I look at race, I'm going to put white and white other together as a category, so that we can look at people of color, black and brown people as well, because skin color makes a huge difference, obviously. So anyway, looking at the body of literature, there was a really clear pattern that the voices of those already privileged, who is the gay, white, cis male, living in areas of relative affluence, was accentuated within the body of research, which caused me to reflect on my own research, my own kind of epistemic bias and injustice that I hadn't really considered, some painful but very rewarding moments. So moving from the scoping review, a little bit on methodology, method, and then study findings. So we're okay for time, I think. So this led me to think about my own study, what was going on there. And when I started recruiting, which group came first? So who came, did I get lots of responses from initially, were cis gay white men. And I'm not going to speak on behalf of cis gay white men, but as one myself, you know, we carry our male white privilege, male white cis privilege, and we speak loudest and our voices are heard more, and they appear to carry more weight because of our privilege. And I paused recruitment, and I constantly was checking demographics. So I had a really thick survey at the end of my qualitative interviews, and they weren't being used for any quant stuff really. They were just for me to keep an eye on who was there, who wasn't there, mostly. So I kind of stopped, and I thought, right, I need to speak to lesbians and bi women, and I want to hear from them. They're not coming forward, and we know that actually sexual minority women are often subsumed in LGBT research. Obviously, as women, they're, you know, minimized within health research. Men take the privilege there. Women, you know, sexual minority women then get subsumed within LGBT research and rendered invisible there as well. And they weren't coming forward for the study. So I paused. And then we hit this really interesting cultural kind of navigating this cultural twists and turns here around gender, because what I wanted was cis women. That was particularly who weren't appearing. I'd had some trans women being interviewed, and I wanted cis women. So I have friends of all genders, all gender orientations, and many across many ages. And I know that some of my, I guess they're all older, my age-ish women, do not like the term cis women, and I'm not going to get into this debate, but they don't like the term cis women. They're not. I don't like the term TERFs. They're not anti-trans. They just don't like the term cis women because they feel it subsumes the word women. And on the other scale, we've got all these younger people. Cis women makes perfect sense to them, and anybody who doesn't agree with them is trans exclusionary. And it really wasn't as polarized as that. I wasn't speaking to people right on the edges of the kind of trans and trans exclusionary debate. These were people on a much narrower spectrum, and I wanted to respect all parties, which gets really tricky. So I wanted to avoid the term cis women, and instead came up with, so I consulted with 5 different women of different ages, genders, etc., and sexual orientations over the course of a week, 6 days, via email individually, because I didn't want to get them all together, to try to find wording that worked. And I came up with lesbians, bi, queer, and pan women, and in brackets, those assigned female at birth. And it was very wordy, and nobody liked it, but also nobody was seriously offended. So I'd found kind of a compromise in that nobody gets what they want, but it worked. And it did work as an approach. And I just wonder, as an insider researcher, as a gay man, I was able to navigate that. I wonder whether a straight person would have been able to do that. So it's a really interesting kind of reflection, and really a chance for us to use our insider privilege to navigate some of these things. Later in the study, I found that there was not enough queer people of color. When I started merging white, other, and black and brown as groups, there were not enough queer black and brown people there. So I paused again, did another consultation. And again, this is the luxury of a PhD where you have time to do this. And I did consultation with a lot of queer people of color that I'd met, developed these really lovely relationships with during the course of the study, and found something really interesting, which I had never thought about before, which is the rainbow branding, the rainbow flag, even the progressive flag that, you know, is kind of cherished and acts as a beacon and a sign of safety in many situations. That for some queer people of color signifies I'm not welcome it goes, that's a white thing, that's nothing to do with me. And other people may have heard that before. I'd never heard that. So I did that targeted flyer, that one that says, let your voice be heard. I used more black and brown colors. And based on the consultation with people, I had explicit faces of black and brown people to let them know that they were welcome, because the previous flyer, the one on the top left there with the rainbow flag, top right, sorry, with the rainbow flag on, they didn't feel that they were required for that. They felt that was a white thing. So I learned a lot. I learned a huge amount during this study. And so anyway, that was the intersectional kind of slant on my own epistemic kind of bias within the study. So just kind of leading to the findings. We're okay for time. That's great. So findings were really interesting. Again, luxurious amount of time with a 3-year PhD. I did all of my findings. I got to the end. I used kind of thematic analysis, and I ended up with findings that I just thought were quite predictable and obvious. The recommendations were, roll out staff training, and it also framed LGBTQ people's experiences as problematic and difficult, and it just, all of this negative framework about LGBT people and how services weren't meeting their needs. And I just thought that contributes to this problematizing of queerness, that we're always seen as problems and difficult and causing extra expense and difficulty for services and not fitting in, and why can't we be normal? And I just realized that my initial findings kind of fed into that narrative. So I'd been reading lots about descriptive phenomenology, and I could go on for hours about that, but won't. And a whole different kind of methodology and a way of looking at my findings that I've been working on. So I went back and redid all 72, and I came up with findings that I felt were relevant and pertinent and applicable, and might actually have some impact, and that were low cost. And I have a background of 30 odd years working in prisons and drug and alcohol settings, homelessness settings, and now primary healthcare with people who've experienced trauma. And I wanted it to not point the finger at hardworking professionals, but instead, with an intersectional lens, look at the wider influences. So these really quiet voices of people on the margins. Daniel here, I don't fit anywhere at all. I don't like the gay community because they're not all that nice and rainbow as they pretend to be. I'm so in the middle. So Daniel was living in a hostel. He was a user of crystal meth and involved in sex work. And he just, again, didn't fit this kind of intersectional position there. And Yasmin, who was a young person of color, I feel like the rainbow flag's not for me. Maybe it's just not seeing people that look like me. Most of the time when I see a rainbow flag, I don't think, oh, that's me. And there was lots of these conversations that I had around the whiteness of LGBT structures and organizations. So if we I'm not, going to do all sort of quant stuff, but just looking at race and an intersectional lens on race. So I separated here white people and black and brown people, and that's not to minimize the experience, say for example, of somebody coming from Poland to the UK. I'm not trying to compare or minimize their experience of racism and discrimination. However, when you put white people and black and brown people together, I think it shows a different slant on race. So within the scoping review, the blue bars are the white people, where there were demographics, and the orange bars are black and brown people. So scoping review was about 90% white and 10% black and brown. And in my study, I managed, with a lot of support and help from the community, to kind of not level that out, but increase the proportion of black and brown people within the study who are severely or seriously underrepresented in LGBT research. So the first finding was this essence that ran through every single interview, the majority of the priority. So every interview contained some sort of reference to people's experiences, either inside or outside of majority groups. So these within services, these normative processes and the collective directions of services, and this harks back a lot to the fantastic work that Sarah Ahmed did in queer phenomenology and other works. I mean, she's become sort of a guru for me, really. Her body of work is phenomenal. So, but within services, we've got these collective directions that privilege core groups of clients at the expense of others, and this very interesting discourse that was in, well, I noticed across interviews, across settings as well, and across locations, in which people said, we don't really collect data around LGBT stuff, or we don't really bear any mind to it within our services, because what's it got to do? And people said, what has someone being LGBTQ got to do with their drug use or their homelessness? And it's one of those times where, as a queer interviewer, I tried to stop my jaw dropping to the ground. You realize that really only a heterosexual or a cis heterosexual person could say that. And I didn't want to point the finger at the workers and go, oh, they're really discriminatory, because when you've worked in those settings for many years, and when you step out of it, as I have, for example, drug settings focus on heroin and crack cocaine users who are mostly in and out of prison, and that's their core group, and they are at risk, and they are a group who are extremely in need of service, and I completely appreciate that. But it creates this tunnel vision where that is the group who needs the most priority. So you can point the finger at workers and say they're being discriminatory about other groups, but actually, if you turn around and face the Home Office and the government, where much of the funding comes from for these services, or much of them, there is a pressure from government to reduce offending, to reduce street homelessness, etc. And that filters down into the services, and creating this kind of tunnel vision that marginalize and others groups who don't fit into that category. And not surprisingly, perhaps, across the settings within the scoping review and my study findings, and hello to Edith England, and thank you for all your work prior to this, was this privileging the white, cis, hetero, or apparently hetero male gets privileged across all of these settings. And this idea maybe that, a vulnerable white cis male pulls at the heartstrings, and people go, oh my Lord, look at that vulnerable male, and he's crying, he needs our help, he's the most demanding of help. And there's some really interesting stuff in my mind about relative privilege, and if you've got a trans person in distress or a trans person using, you kind of go, well, they're trans, so they're going to be in distress, whereas a heterosexual cis white person shouldn't be like that. There's a big gap between how they are and how they should be. So there's all of this kind of patriarchal normative privilege running through the core of things. And I think a simple and cheap thing for us all to do is look at our own organizational and individual processes that may establish or reinforce core groups. And I had to do that individually during the study. I had 2 public advisors of colour, and as we established psychological safety within that group, they started to call me out on stuff, and it was painful, but so valuable. So that was the main finding around just the majority of the priority and that kind of statement. The second one, I'm checking for time. Okay, wrapping up. So at the interface and guidance and practice, so there's fantastic guidance around. So, for example, providing substance use support for LGBT people in drug services, but it's not implemented. There's a lot of pushback from services. And the advice there is to involve staff in workplace processes. If you're bringing in new policies around LGBT people or people of colour, there might be issues with staff, there might be some pushback. Bring them into those discussions and build in evaluation afterwards. And the other thing is the focus on economic disadvantage and poverty as the main driver of disadvantage, and without denying the huge impact that poverty has on people's experience of disadvantage. If we just focus on the economics, then we lose the wider picture. Severe multiple disadvantage in those 3 categories excludes LGBT people, marginalizes them. Adverse childhood experiences, which is another framework we use. Great framework. We've accepted that as kind of an ontological truth, but it makes no mention of racism or sexism within it and those experiences. So in summary, kind of LGBT people were bounced out and marginalized or excluded, not only from mainstream services, but also those services designed to support people excluded from mainstream provision. Working forward, this study seems to hit a nerve with some of the kind of larger statutory organizations, and I'm mapping out, hopefully, a larger plan of work to look locally at how we can improve the voices of marginalized people. Been working on some grassroots network building with people of color, and doing some follow-up work analyzing the interviews with people of color within the PhD. The ARC have been absolutely amazing and hugely supportive, and thank you to them. And that's it. I'll stop sharing now. Thank you.